Pregnancy is a lovely and beautiful journey, but sometimes in some women it can be a difficult period because of nausea and vomiting, especially in the first trimester. Meanwhile, not all women will experience nausea and vomiting in their pregnancy, but when it does occur, it can be serious and sickening. Welcome back to my channel. My name is Iyabo. In today's video, I'll be discussing one of the signs and symptoms in early pregnancy, which is morning sickness. What is morning sickness? Morning sickness is the act of feeling of nausea and vomiting during pregnancy. Nausea is the feeling of vomiting, while vomiting is the actual throwing up during pregnancy. About 80% of pregnant women feel nausea during pregnancy, while 60 to 70% of pregnant women actually throws up during pregnancy. Despite the name morning sickness, doesn't mean that it cannot occur at any time of the day during the pregnancy. How soon can morning sickness start? Morning sickness can start as early as 6 weeks, but in some women it starts between 8 to 10 weeks of pregnancy, but averagely around 9 weeks the woman feels the signs and symptoms worsen in that pregnant woman. What causes morning sickness? Morning sickness is as a result of hormonal changes in the woman's body, and the hormones responsible for this nausea and vomiting is hormone progesterone and hormone HCG. It can also be as a result of low blood sugar in the body of the pregnant woman. It can be as a result of blood pressure fluctuation, when she smells food around her, some smells of food, she doesn't like it, it can be as a result of that. And mostly, sometimes it's as a result of stress and anxiety. Sometimes when the weather is hot or the weather is too warm, it can be as a result of that. And also, it can be as a result of indigestion, because during pregnancy, especially the hormone progesterone tends to slow down the digestive system, and then when digestion doesn't take place, it can prone the woman to vomit. What are the signs and symptoms of morning sickness? The common signs and symptoms of morning sickness are nausea, vomiting, loss of appetite, heartburn, motion sickness, and sometimes feeling something stuck in the throat. How long does morning sickness last? Morning sickness tends to fade away from 13 weeks, but in some women it goes beyond that. It fades away from 14 to 27 weeks, and in the rare case it continues until the end of that pregnancy. What are the management of morning sickness? 1. Avoid rushing out of bed, especially in the morning. What the woman should do before getting out of bed in the morning, she needs to sit at the edge of the bed with her legs touching the ground, and she can take some dry biscuit. Especially dry biscuit works better. I am talking from experience now. She can take a dry biscuit, and when she do that, she will sit for some time, not less than 5 minutes, before she tends to get out of bed. And should avoid eating heavy meal at the same time, meaning She shouldn't take large amount of food at a go. The woman should take her food at a frequent interval, at least not less than 2 to 3 hours in between her meal, and should take it in a small amount. And the food also should be less fatty. Don't take don't take fatty food. Fatty food tends to slow down in the digestion, and with that it can irritate the stomach and cause vomiting. So the woman should take less fatty food. Also, don't take spicy food. Spicy food can further irritate and causes nausea or vomiting. Avoid alcohol. Avoid coffee, especially in the early part of pregnancy where the nausea and vomiting symptoms are so troublesome. And also take adequate amount of water. Some pregnant women, they find it difficult to drink water during pregnancy because at the sight of the water they tend to feel nauseating, but this is what a pregnant woman cannot do away with. Water is very essential in the body during pregnancy, so the woman is advised to take water regularly by sipping a water, or even putting a straw and taking it gradually at a very frequent interval. Also, the woman can get an ice cube, and start licking it. This when it's melted, it's also water in the body. So you should get an ice cube and be licking it gradually. It helps also to prevent nausea and vomiting. And the woman is also advised to rinse mouth, especially after vomiting. And most time it's helpful to use the lemon water. That's get a lemon and squeeze it inside water. And even when she's taking her water, she can add this lemon water because the taste of lemon water will also help to prevent nausea or vomiting. Can also use this lemon water to rinse the mouth after vomiting. She can also use a fresh ginger. Just slice it, fresh ginger, add it into the water. Use it to, you can drink it, or use it to rinse the mouth after vomiting. And also can slice the lemon and smell it. When you smell this, when you feel nauseating or feeling the act of vomiting, just try to smell this lemon or this ginger water, and try as much as possible to stay away from things that you know when it smells you feel nauseating. And food also, food can be eaten cold, because sometimes when the food is being warmed, the smell comes out more. So the woman can try to eat the food when it is cold if it's okay for her, because it will help to prevent to reduce this nausea and vomiting. And of course, take your prenatal vitamins. A pregnant woman is advised to always take the prenatal medication because it helps to support the pregnancy and prevent some complication in the development of the baby in her womb. So she'll take her prenatal medication, and the vitamins that she's taking, if it's affecting her in the way she doesn't like, you need to report to the hospital, report to your healthcare provider. Do not just stop taking your prenatal vitamins, or by going to start taking the one you feel that you want to take, or the one your friends is taking. So make sure you report to the healthcare provider, where the medication will be looking into, and probably it can be changed. And sometimes when they vomiting after all this precaution, and the woman have taken the precaution, have gone through managing it this way, and it doesn't still help because of nausea and vomiting, especially the vomiting, she need to visit her healthcare provider. Most time, the woman will be admitted and be given intravenous infusion because of dehydration. She need to be rehydrated, and this can lead to admission. On the final note, this woman that is going through nausea and vomiting, family, especially the husband, the immediate family, the friends, colleagues, need to support this woman. The woman needs support because nausea and vomiting is a very critical condition. The woman becomes weak. She tends to lose her strength. She tends to not feeling to enjoy the pregnancy. So what she needs this period, please, she needs support, especially those that have older children. She needs someone around to take care of these children. If a woman works and she feels that she doesn't have the strength to work, she can discuss that with her manager. Maybe she can take some weeks off from work so that in order to have adequate rest. But our husband, please try as much as possible to support this woman and especially the house chores. Thank you all for listening. Thank you for watching. Do well to subscribe to my channel. Until I see you all in my next video.